Okay. Hi, Becky. Good morning or good
Michael.
afternoon.
Yeah,
Thank you for joining us today to have a little conversation. I always love talking to physical therapists who I have a lot of respect for and finding out where they've come from and where they're headed, what their journey's been. And if you could just tell us a little bit about yourself, where you're from, and what your current responsibilities are at WashU.
sure. Well, thank you for having me. So my name is Becky Lawrence. I'm an assistant professor in physical therapy and orthopedic surgery here at Washington University in St. Louis School of Medicine. And I'm originally from Genoa, Illinois, which is northern Illinois out in the cornfields. And then I've sort of traveled around the Midwest for my various educational pursuits. And I'm really happy to be here in St. Louis. So my specialty in terms of research is in shoulder biomechanics.
Very good, Becky. And going back to kind of the beginning story, how did you decide to become a physical therapist?
Yeah, the short answer is that I'm a physical therapist because I can't be an astronaut. And I saw a shuttle launch when I was 9, and it just like lit me up in terms of my excitement for science. And I really wanted to be an astronaut, but within a couple of years, I knew I couldn't because of, eyesight restrictions. But I really wanted to be a mission specialist, which were the scientists on board. But even after a little while, my eyesight was too bad that I couldn't even qualify for one of those. And so then I just was looking for something where I could kind of still be involved in NASA or kind of that area. And but unfortunately, I didn't really know what that would look like if I wasn't an astronaut. And I looked into like astrophysics and aerospace engineering, but I was kind of convinced that I didn't really have what it would take to do that level of science. And so I kind of settled on, I shouldn't say settled, I was really interested in like civil engineering. So I started out actually in civil. But right at the end of my senior year of high school, I had a knee injury, and that's what introduced me to PT. And what was interesting was I distinctly remember the moment I was sitting with my therapist, and after the injury, it was an ACL tear. I went through post-op, or rather pre-op rehab, because I still wanted to play my senior soccer season. And so I got a really good relationship with him by the time we got into the post-op phase. I distinctly remember this one day I was sitting there with him, and he was doing patellar mobilizations. And I remember joking with him, being like, "Oh, what are you doing? What purpose is this for? This seems kind of like you're just taking a break, wasting time, And he was like, no, this is really important. That we need to move the kneecap to improve the movement of the joint, which disperses force. It acts as a pulley, and so forth. And I remember thinking like, wow, okay, so this is engineering. But I'm not building the bridge or designing, the road surfaces. I'm working with what's already been given me, and even better yet, hopefully making people's lives better and doing it. And that just was a whole shift for me. And so it kind of made me realize that I could do the engineering, but also be sort of, serving people at the same time. And so that's kind of how I got to PT. So I'm still very obsessed with NASA. So it's still my passion, but I love what I do now, and I'm pretty lucky that I get to have two passions in life, or at least two passions.
Yeah, that's great. I thought I saw something about you working with NASA in your CV, so I thought that was really...
Yeah, actually, I got to kind of merge the two together when I was in PT school. We had a few weeks off during a summer, and I applied for an internship at the Johnson Space Center and got to work in the exercise physiology laboratory, which we were testing the advanced resistive exercise device, which is the piece of equipment that allows for simulated weight-bearing resistance training when they're on board the International Space Station. And so we were doing the preliminary, it's called man-in-the-loop tests, to look at the effectiveness and the efficacy of that device for preventing muscle loss and bone loss while they're on orbit. And so I spent a summer down there, and that was really my first introduction to research. And I got to pair the human health side with with PT and NASA, and I got to work with the athletic trainers who get to rehab the astronauts when they come back from station. And so that was really, really cool. So yeah, I've got to merge these two passions together a few times.
Oh, that is so exciting. And I guess it is so true. The no gravity situation that these astronauts experience, it's a huge impact on their bodies. So,
Yeah, absolutely. What we were kind of, what's interesting is that when they were on station for, usually at the time it was about 3 months, now it's longer, that they usually come back. The amount of bone loss is, if I recall correctly, on par with what happens in late, aging, in terms of the fact that they lose enough to be considered osteoporotic. They will gain it back through exercise on Earth, but that's how much they lose. And they have a whole host of other issues with vestibular issues, cardiovascular issues, balance, lots of, so they come back a very complicated patient, but with a huge threshold for recovery. So they're a really interesting population to work with.
it made me wonder, is it easier for people to raise their shoulders in space because there's no gravity?
Yeah, it's a good question. I presume so, because you're not really working against gravity. Everything is, it's weightless. But yeah, I wasn't focused on the shoulder at that point, so I didn't think much about it.
Wow.
But you
So
can
I
see these images of these astronauts like holding up these massive satellites with one hand, and on Earth they'd weigh, thousands of pounds, but they can kind of move them around. So pretty cool.
Now, I heard you mention about you having an ACL injury, and this was from a soccer injury. So, are there other sports that you played growing up? And obviously, you have experienced injuries, which kind of led you to the physical therapy field.
Yeah, so I played, my primary sports were basketball, soccer, and softball. But then, so I played those competitively. But then I also played sort of recreationally tennis and golf. And so we try to just stay active and have fun. But yeah, those are my primary. And I do a lot of hiking now too. So that's always, I don't know if that's really a sport, but it's
Oh,
a lot of fun.
that's great. I love a multi-sport athlete.
Yeah.
I was a tennis player in college and also played basketball. A lot of people didn't believe me because I'd never played formal basketball till I went to college, but
Okay.
it worked out really well. It kept me busy
Yeah.
during college years. So, yeah. Was that your whole family was very active in sports? Is that what got you super involved in different sports?
Not necessarily. I think, to be honest with you, I think the thing was, is we grew up in a small town. And so if they were going to have a sports team, a lot of people had to be on it. And so, we weren't necessarily a great athletic school, but, in order for there to be a girls basketball team, you got to field 10 girls. And so, a fifth of the, or yeah, about a fifth of the class had to be on the team. And so you kind of did a lot of different things because it's a small school. And, sometimes I joke that you just had to pass the physical to make the team. And so, you got a lot of really great experiences in band and sports. And, if there's going to be all these clubs, people have to participate. And so we did a lot of things, which was a really great way to get exposed to a lot of different things as a kid.
Yeah, that's true. And we worry oftentimes for these young athletes who are so focused on this one sport, they don't do anything but baseball or whatever sport that they're in. And so compared to you, you got so much variability in movements from doing
Mhm.
a lot of different things. So yeah.
Yeah. And it was just a lot of fun. So.
Absolutely. So, your journey after physical therapy school was going through the orthopedic residency program and then successfully getting your OCS, or for those people who are not familiar, it's the board certified clinical specialist in orthopedic physical therapy, and then going into the PhD program. Um, so a lot of clinical emphasis first and then research. Was it always your intention to go into research at some point?
Not necessarily. I mean, I got into PT for the clinical side and I really loved the clinical side. But then, I had that exposure to the research at the NASA internship that really kind of sparked an interest. That was a really fun thing to do. And the process was really appealing to me in terms of asking a question and then rigorously pursuing it. But really what changed was there was about a year or so after residency, there kind of something happened in the faculty where I think the dean needed to step away. And so then everybody kind of shifted up. And so then there was an opening that they needed to have somebody cover the therapeutic exercise course. And the faculty, this is where I did my PT training at St. Ambrose University. For whatever reason, they're very generous people. They reached out to me and said, could you teach this unit? And so it gave me the opportunity to teach. And that was something I never really considered, because that to me are the experts, and I didn't feel like an expert, but that was such a great nurturing program that I felt compelled to help really in any way I could. If they asked for help, like, yeah, absolutely, I'll help you. And so I really stepped out of my comfort zone to do that. But then I found it was a really enriching experience because as I taught, I was bringing in examples from the clinic. And then when I was in the clinic, being able to explain something really simply to a student, it really helped me do the same for patients in the clinic. And it just was this really synergistic experience. And it got me thinking about, well, maybe I could eventually learn to do this really well, to teach and contribute to the profession beyond clinical practice. And that got just me thinking about, well, what would that look like? Well, my mentors encouraged me to go get a PhD. And so that got me looking. And I knew that finding a good mentor was really important. And so I found Paula Ludwig at the University of Minnesota, and that's how I got there. And I was really excited for her because she was just an extraordinary researcher, but she also has a really great reputation as just a really great human, too. And then also having that research intensive university. So it kind of all came together. And then when I was there, she really encouraged me to pursue research. And I think that's really important. And sort of, if I were to say, my story is that I was so lucky to have mentors who challenged me to do something or really sort of helped me find the courage to do something that I wasn't sure I could do, or I didn't even know was an opportunity. And she was one of those people. And so that's how I kind of got into research, even though that was not my intent from the beginning necessarily. She certainly changed my entire direction with her encouragement. So.
Which leads nicely into my next question, Becky.
Oh.
I believe you can learn a lot about a person by knowing who are the 5 people they interact with the most. And this could be personal or professional, but who are some of your most influential people in your life? And
sure.
Dr. Paula Ludwig is one of those people.
Yeah, absolutely. Paula's, outside of my family, in terms of my professional life, Paula is at the top, certainly. She's just had tremendous influence on me and all things professional and personal too. And then Mike Bai was my postdoc mentor. I really got lucky second time, and he's at Henry Ford Health in Detroit, Michigan. And he's just, again, he's an engineer, a really solid thinker, really kind and generous person. And so I really, really lucked out with another great mentor, both very generous people. But then here, landing at WashU, like everywhere you look, there's just people that are experts in their field. They're kind and generous with their time and their feedback. And so here, Marcy Harris Hayes, I would consider a mentor, Linda Van Dillen, Catherine Lang, Gavin Earhart, Mike Harris, Nancy Bloom, Renee Ivins and Cheryl Caldwell. There's just so many just tremendous people that I've only been here for really since September, and have changed the way I think or approach science. And so it's just, I feel like I really hit the jackpot with a whole community of mentors right here. So yeah. I'm just a really lucky person, I'll put it that way. So
I think there's something that you must be doing that attracts a lot of good people around you too, Becky.
Oh, I don't know. And then I should mention too that the faculty back at St. Ambrose, I think they started to plant the seed, to be honest with you. And I still keep in touch with a lot of them, and I would consider them mentors. So I just try to be as sponge-like as possible. And I think people tend to be very generous. So.
Yeah. And what are your current research projects happening in your shoulder biomechanics lab?
Yeah, so right now I'm lucky to have a funded R00, which is the second phase of a K99 R00 NIH grant. And in that, we're looking at the predictors of rotator cuff tears in people who are in the age range, the 50 to 60-year-old age range, where you're going to see lots of different things in the shoulder. You're going to see healthy shoulders, but you're also going to see people with tears. And so we're looking at the sort of the intersection of a lot of different factors, including shape, how our shoulder bones are shaped, how much we use our shoulders in terms of occupational exposure and athletic exposure, how we move, whether or not we may be experiencing tendon impingement, biomechanical factors and demographic factors. So we're looking at understanding the causes, the potential causes of cuff tears, but then also looking at, well, what's the distinguishing factor between those who can remain asymptomatic and have pathology versus those who experience the pain and dysfunction. So we're really investigating those actively. But I'm also, as trying to get things up and running here, looking into pursuing a lot of the questions that remain sort of percolating in my mind after my postdoc, which relates to optimizing function after rotator cuff repair surgery. So lots of fun things going on right now.
Yeah, rotator cuff is a worldwide problem. So those are very important works that you got going in your lab.
Oh, well, thank you. I really enjoy it.
Well, when you're not in your lab or teaching students, or I think you review a lot of manuscripts also, but how do you spend your time to boost your happiness?
Sure. Yeah. I'm a bookworm to some degree. I love to read, documentaries. I love to go to museums. I just love to learn. And so a lot of times I'm doing that, but I also love to hike. I'm a cyclist as well. And spend time with family too. Those are the big things. So, yeah, but I also just love what I do. And so it's oftentimes hard to separate work from play, to be honest with you. So.
Yeah, I can totally resonate with that. Any really good books that you have read recently, or, some of your top favorite ones that you have?
Oh man, see, that's a tough one. So right now I'm actually it's been over 3 years, I'm doing an intensive study on sort of the Roosevelts actually. And so there's been some exceptional work. No Ordinary Time, which is by Doris Kearns Goodwin, is a really great book that talks about Eleanor Roosevelt and FDR during World War II. That's just a phenomenal book. It was a Pulitzer Prize winner. I read a lot of history and biography, so I'm not sure. They're kind of nerdy. But right now I'm reading a trilogy biography of Eleanor Roosevelt by I'm blanking on her name right now. But it's a great work. Just, it's always fascinating to me to read about people who are, complex individuals that still sort of like overcame so much challenges and hardships to do great things. And so I'm fascinated by the Roosevelts right now.
Yeah, that's great. You and Shirley should have a conversation, because you will be reading all of those books that you had mentioned. So.
Oh, really? Okay. Yeah, I'll have to. Barb Norton and I often will talk about these books, and she has to take a break. Like she will move around on different topics, whereas I've been in sort of my mom would call it a rut, in terms of I call it a focused study on a topic.
I like the sound of focus study really well.
Yeah.
That's great. And you're going to be my guest lecturer for the June Movement System Monthly this year. A little shout out to the Japanese movement professionals would be great. They're looking forward to meeting you in Zoom.
Yeah, I am as well, meeting them.
Yeah, awesome. Well, thank you so much for spending a little bit of time with me. I really enjoyed hearing your past stories and seeing where you're headed. And just like you, I'm super lucky with being surrounded with all these amazing people around me that I just continue to learn from. So I look forward to learning more from you in June.
Oh, thank you. I look forward to it.
All right. Thanks, Becky.
Thank you.